Welcome to Integrated Health of Indiana. I'm Dr. Trevor Miller, and we are honored to have you coming into our clinic. This is going to be a short video introducing you to our clinic, helping you get set up to do the right paperwork, where to find the paperwork, and then introduce you to our services and give you some testimonials or a place to go so you can see what other patients are saying about us. First of all, I'm Dr. Trevor Miller, as I said, and I am a board-certified chiropractor, functional medicine practitioner, and I'm a licensed acupuncturist. And I do all of these things because when I was practicing, I found that just chiropractic didn't get things done, or just acupuncture didn't get things done. And so eventually we came to add functional medicine to the mix, and that seems to be the icing on the cake. So when you're dealing with patients, and the way we kind of figure out, a lot of people are coming in just for chiropractic, because I've been a chiropractor for 30 years now. But when we see people that adjust and then don't hold, and then we adjust them again and they don't hold, well, at that point in time, we know that there's something else going on in the body, and that's what sets us apart. A lot of other chiropractors don't test. They don't see why the inflammation is there. They'll throw CBD oil or they'll throw whatever vitamins at you. We test, we don't guess. We want to get to the root cause of your problem and help you feel better so you can help your family feel better, and then you can help your friends feel better. That's what we're about here. We are about empowering people to get better, feel better, and do better, to live their best lives. And so to help you get the most out of this first visit, scroll down to the bottom of the page on our Integrated Health of Indiana. So if you go to integratedhealthofindiana.com, scroll all the way down to the bottom, and you'll see on the bottom right-hand side a little link that says self-registration. Click that link, fill out your paperwork. It'll go directly to Tina, and Tina can then log you into the computer. I can see your intake paperwork, and we can get you going. And here at Integrated Health of Indiana, we believe in precision chiropractic as well. When we take x-rays and we do the line drawing analysis, we'll show you normal as compared to where you're at. And then we can bring you in here and we adjust manually, either in the chair or on the table or both. And then we can also use the activator. So for those of you that don't like to have the manual adjustment and hear that popping and clicking sound, we do have the gentle adjuster approach, the activator approach. So whatever your needs may be, we want to make sure that we are addressing them. And once again, here at Integrated Health of Indiana, you always drive the boat. So as we are doing things with you, if you don't like that, just tell us, and we can change that to fit your needs. And so just like we like precision nutrition and we like precision chiropractic, we test, we don't guess, we also do digital x-rays. And when we do those digital x-rays, we put them on the computer and we run them through a CAD/CAM system. And like I was talking about in the adjusting room, we can look at what's normal and where you're at, and then we slowly start to work towards getting you to that more normal. This does depend on if you're coming in for a quick fix. Are you wanting just acute care chiropractic, or do you want true corrective care? True corrective care may require more than chiropractic, but we will tell you about that when we do the cost of care. And as always, at Integrated Health of Indiana, when we do a cost of care, you always drive the bus. You don't have to do everything, and we'll tell you, we can rank what's most important to what's least important so that you can get the care that you want and can afford, because we don't want to cause stress. So this is one of our IV rooms, or functional medicine rooms. In this room, you're in a very calm, quiet setting. Once again, I have the lights on so you can kind of see the room. But we can do couples with IVs. We do that quite often. And you have to remember, to actually heal, to actually properly heal, your body needs to be nourished both inside and out. So if you don't have the proper amount of vitamins and nutrients, well, we can start to enhance that experience and help with doing the micronutrient IVs. My wife is a registered nurse, and she administers the IVs in this room and a couple others. We actually have several. You'll see it on the tour. And just know that this is not your typical IV lounge. You know, it's not a run them in and run them out. You get to sit down, you get to relax. We have blankets. You can have a partner in here with you at the same time. But also in this room and the other rooms, we do detox foot baths. We also do acupuncture in these rooms. So we can do multiple things in these rooms. And one of the other things that we do, this is kind of where we do our patient education, where I was talking about testing and not guessing. We want to look at your hormones if that's appropriate. We want to look at how your microbiome is doing. And then we want to make sure that everything is in the body when we do like an organic acids test. We want to make sure that the body has the nutrients in the fuel tank so that when your body needs it, it's there. And then we measure urine as well, because that way we can tell what's coming out. So micronutrient IVs with the detox foot baths, once again, we're taking care of the whole person. This is not a one size fits all. This is a your size fits you. And on that note, we also offer full laboratory services. So we can draw your blood. We use LabCorp, which the same labs that both all the local hospitals use LabCorp. They do have some of their own in-house testing that they can do for easier things, just like we can do an A1C in-house and stuff like that. But all in all, we are a multi-purpose. There's nothing else like us actually in this area, or that I know of. I haven't met any of my other functional medicine practitioners that are set up the way that we are to take care of the whole person. And if there's something that if there's something that we don't service here, and we see that we're not going to be able to take care of you, we have a vast provider network that we can tap into to make sure we get you to where you need to be. We don't want to waste time or money. Those are both precious commodities that, well, time you can never get back, but you can always earn more money. So we really don't want to waste either, though. And we want to make your health care here the most bang for your buck. For my chiropractic patients, we come into this room, and this is our report of findings room. We also do bioimpedance analysis in here. So if we are looking at your body fat and we're trying to lose weight, we come in here because this is where we do the tracking. But this is also for our chiropractic patients, where I show their x-rays on the big screen. We look at their range of motion findings. If we need to draw blood in here, we can draw blood and we can spin it down. This room is a multi-purpose room. It's also where we do our first exams for our chiropractic patients and our functional medicine patients. Currently, we are in Integrated Health of Indiana's passive therapy bay. In here, we have decompression therapy. We have 3 types of decompression therapy. I've been doing decompression for as long as I've been a chiropractor. I learned the values of decompression when I was in school. So we've always had decompression. I have cervical decompression, I have lumbar decompression, and we also have the flexion extension decompression in 2 different forms. So decompressive therapy is something that we've always done, and it's that added thing to help the body relax. But as we are in the passive therapy bay, right now I have the lights up. Typically the lights are off. This is so that when you're on decompression, or you're in one of the chairs, or you're getting muscle stim, you can relax. Bringing on that parasympathetic state allows the body to go into rest and repair. And that's one of the things that you have to be able to do. And that's something that other chiropractors and other healing places, they don't think about. Because we know how good it is, or how important it is, to not only have the body relaxed, but have the mind relaxed. That's part of our functional medicine background or upbringing, because we know these little things, these little tricks to get people better. Similar to the other functional medicine, acupuncture, IV detox room, this is yet another room that is set up to do those wonderful soothing types of therapies. You can sit in here, and Jessica has heated eye pillows, and the blankets are heated so that you can be comfortable, you can relax, and you can start your healing journey before you ever even walk out the door. So this area is also used for acupuncture. And if you don't know what acupuncture is the ancient art of using needles that is a single piece of steel or metal that's wrapped around itself and acts like an antenna. And that is to draw the energy into the body. And acupuncture, we use that for sinuses. We also do dry needling. And those things can be done in this room as well as several other rooms in the clinic. We're designed to give you privacy and to give you that experience that you won't get anywhere else to help kickstart your healing journey. We are now in the active therapy room. This is where you start to rehabilitate muscles. This is where we do stretching and we do motion, because we know that being active is an essential part of having a quality of life. If you look at the blue zones, all of the blue zones, these people that are living to be 100, 105, 110, 120 years old, they all move, and they all move daily. And so our job is to get you to where you can move daily. So we do strengthening, core strengthening, we strengthen the legs, we work on gait. We do these things to help you so that you can have the most impact. You can be the best version of you that you can be. We're on a mission here. Our mission is to make our patients healthy, and they can help their families be healthy, and that incorporates the whole being. And we'll get a little more into that here in just a few minutes. This is the functional medicine report of findings room. So when you enter into functional medicine, remember we have several tracks here. You can do chiropractic, you can do functional medicine, you can do acupuncture. Whatever the case may be, you can come in and do your IVs individually. You don't have to be a chiropractic or functional medicine patient here. All you have to do is call and see. But for those of you that are watching this video that are coming in, this is where we do functional medicine. If you are looked at as being a functional medicine patient, then this is where, after we do the testing, it'll go away. It takes about 6 weeks for some of the testing to get back. Then we'll sit down with you and go over those findings in detail, and you can ask questions here. This is where there's no judgment. You can sit here and talk about whatever you want to talk about, and that's how we get to know you, so that we can get in there and start to look at what is causing the complex chronic diseases. Diseases like Crohn's, and diseases like irritable bowel and diarrhea and diabetes. Whatever the case may be, we start to work on the underlying issues that turn on the genetics that make those things happen. And what we want to do is go in and silence those genetics so that the body can then start to repair itself. And that's why the whole clinic is designed to be calming, so your body can sense that this is a safe space, and then it can calm down and it can start to repair and relax. So I would like to just take a second and say thank you for sitting through this video. You can now see most of all of the services that we do. I always forget some things, but with that in mind, below you will find the link to begin the paperwork, and we look forward to seeing you.